is 80% the magic number when you're aiming to decrease those blood sugars. A common misconception for those with type 2 diabetes that are aiming for remission is that they need to be in range 100% of the time. That means to have their blood glucose perfect at all times. I'm Nerys Frater, I'm a GP, and I help people achieve remission of their type 2 diabetes or pre-diabetes by using weight loss techniques. A lot of people have got or bought blood sugar monitors. So either these finger prick tests that you can actually buy on Amazon, but if you've got type 2 diabetes, especially if you're on medication, you may well have been given them by your GP. So these measure the capillary blood glucose level. You prick your finger, you get an instant reading of what's going on inside your body at that minute. And although this is amazing, I'm finding that a lot of people are not actually that familiar with what the numbers mean, and it can cause a significant amount of stress. And that's what I'm hoping that'll help you from watching this video. Other trend I'm seeing at the minute is buying these continuous blood glucose monitors, or again, you might have one given to you by the NHS, but locally you can only really be eligible if you're on insulin or medication that lowers your blood sugar and causes hypos. These are the monitors you can put on your arm, and they stay there for 14 days, giving you a really good reading, a continuous reading even, of what's happening inside your body day and night, as long as you're scanning it frequently. So again, what I find is that people have these devices and they want to see what's happening inside their bodies, which is amazing. It gives you so much information, but it can cause anxiety. And the anxiety that I see, especially people that have been doing it for some time, have decreased their blood sugars, and they get a bit lost with knowing what they're aiming for. Because what they notice is the blood sugars will go up and down all day long. And of course it does. Your body's trying to keep your blood glucose level at this perfect stage. And too high, it needs to bring it down, but also too low, and it needs to bring it up. So you will see these ups and downs throughout the day. Food is the main thing that will change your blood sugar. If you eat a sugary treat, then of course it's going to raise your blood sugar higher than eating a bowl of broccoli would. So why am I mentioning this 80% number? Because if you have type 2 diabetes, you are aiming to have the blood sugar in range 80% of the time. I don't have type 2 diabetes, and my blood sugar more than likely is in range just over 80% of the time. I would not expect my body to keep that blood sugar perfectly in range at all times. For example, if I ate a croissant with orange juice for breakfast, yes, more than likely my blood sugar will go out of the range, but it won't stay out for long. My pancreas will be working to bring it back down to baseline quite quickly. And that's what people with type 2 diabetes are struggling to do. They're struggling to get the blood sugar down quickly, but also to keep it at that low level. And what levels are we talking about? The target blood sugar should be between 4 to 7 millimoles if you're doing this finger prick test. As I said, mine can go up to 13, but it will come down quite quickly. With somebody with poorly controlled type 2 diabetes, they will never get their blood sugars into that 4 to 7 range. Even if they've been sleeping overnight and they wake up in the morning, it is likely to be in the teens if your control isn't that good. But you know, the way us doctors measure or monitor your blood sugar is using a blood test called HbA1c. This number is not a reflection of your blood sugar at that minute. It is in fact an average over the last 3 months. To explain it briefly, it is the amount of glucose that's attached to your red blood cell, and your red blood cell will live in your blood for 3 months. So it'll give you more of an average than this random reading. You should know your HbA1c, by the way. Ask your doctor if you don't know. Lots of people have access to their blood results online, so find out what your HbA1c is. Anything less than 42 is the target, is normal. Between 42 and 47 is the range for pre-diabetes, and higher than 48 is type 2 diabetes. Now, the higher it is, I'm afraid, the worse your control is. So if you think about these numbers, if you're less than 42, your blood glucose is in range 80% of the time. If your HbA1c is 58, then you're actually in range 56% of the time. So you can see the big drop. And then if your blood sugar is really bad, so HbA1c of around 100, it means that you're only in range 20% of the time. And that's the number we need to improve. So I want you understanding more than anything that even people without diabetes do not have a perfect blood sugar at all times. It does go up and it does go down. That is normal. It isn't just food that affects it either. Medication can do it. Lack of sleep, a bad night's sleep, can raise your blood sugar. Having an infection can raise your blood sugar, as well as stress. And I see this causing a huge amount of problems. So just be aware, there's lots of things that cause that blood sugar to go up and down. It's exaggerated with type 2 diabetes, but it's still happening in all of us. Now, interestingly, and I want you to use this as motivation, is that as you make changes to your lifestyle, as the weight comes down, as your pancreas starts responding quicker and more effectively to these ups and downs of the blood sugar, you actually improve how you can cope with sugar itself. So if you eat a slice of cake when your HbA1c is 80, say, that is going to cause a really high peak for a very long time. So you're going to have high levels of sugar in your blood, causing damage for a long time. If you got that HbA1c down to 48, that slice of cake will be managed or processed or metabolized much quicker, meaning that there is less damage. But of course, I keep mentioning this word remission, and that's because we do not yet know if you can cure type 2 diabetes. There is a hugely more chance of doing it with lifestyle changes than a medication. However, it is remission. So you cannot go back and eat chocolate cake every 2 hours and expect things to be fine. Things will go backwards if you revert to the way you were eating before. The other reason this 80% number is really important is for you to create a sustainable lifestyle. Me telling you never eat chocolate, never eat bread, pasta, rice again is completely unrealistic. However, if you could stick with those rules for 80% of the week, even of the day, that's going to have a huge benefit, because 80% of the time is quite a lot, isn't it? But you're still allowing yourself to have treats. And for many people, they can live their lives this way. In fact, this is what I do. I follow the principles. I do have takeaways. I do have chocolate cake, but it is 20% or less of the time. So just to keep an idea, you're always thinking ahead. Yes, you want short-term results with decreasing your blood sugar, but you also need to be playing the long game. So that 80% number is so important. So be kind to yourself when you're working towards your goal. Just keep chipping away. Do something positive every day, and honestly, it will compound over time.